Sponsored by Texoma Medical Center.
Cauda Equina syndrome is a rare but serious condition with extreme pressure and swelling of the nerves at the end of the spinal cord. Texoma Care neurosurgeon Dr. Abdul Baker joins us to discuss this condition and how it's treated. Thank you, Dr. Baker, for being with us today. I actually had to Google this just to pronounce it. Cauda Equina. Tell us about this and what the symptoms are.
Cauda equina is Latin for horse's tail. Basically, at the tip of the spinal cord, there's a bunch of nerves that just kind of take off, and that structure is, in a broad term, called Cauda equina. And Cauda equina syndrome itself is a condition that results in compression of the nerves in that area, and it can manifest anywhere from having nerve compression that causes you to not have control over your bowel and bladder function and not be able to feel your legs or be weak in your legs, and also not be able to feel yourself in the genital area.
Wow, this sounds terrible. So why is it important to seek urgent treatment, not something you want to wait on, right?
Yes, Cauda equina is actually a medical emergency, or actually surgical emergency for that matter. And you need to get to the area where the compression is. Compression can be caused from a disc herniation, from bleeding in that area, a fracture, a tumor of any type. So you need to get to that area and take the pressure off the nerve by resecting whatever the cause of compression is.
And is that the only treatment for this syndrome, or is there something else you can do?
Most often, Cauda equina syndrome is caused by a mass compressing the nerve. Now, there are other conditions that can masquerade the symptom or the syndrome of Cauda equina that may not be surgical, but one thing you have to do if a person presents with a cluster of these symptoms, to get an MRI at the back, confirm that there's no compression. Once the compression is ruled out, then you can work your way down to other medical causes.
And is this common?
It is not common, fortunately, but the ramification of untreated Cauda equina syndrome can be devastating, because a life sentence of not having bowel and bladder function could have huge impact on a patient's life.
Absolutely. Well, thank you for sharing this information with us today, Dr. Baker. We'll be right back.